Hi everyone, today we talk about pedals. It's a very important topic, so stay here. We basically have two different ways of controlling the instrument in our dental unit, but also in the dental unit in general. One way is to control pneumatically all the instruments. The other way is to control electrically the instruments. In our case, we suggest to control pneumatically the instruments, but this makes some confusion in the market and in the opinion of you that you're watching probably this video, because it's not very clear. We want to clarify this and give you more information because it's very important. The pneumatic way of controlling the instrument is very useful for us because you reduce a lot the electronic that you're going to put inside the dental unit, because we can control the instrument with air. Let's say most of them are useless to control by electricity because we have the source that is a compressor, and then we have the instrument that is a turbine. The source is air, the output is air. We don't need anything else to control that in the middle, if not a pneumatic system. So when the electric can be useful is only to control the electric micromotor. In this case, it's better to control the system in that way. But let's clarify a bit better. Any kind of micromotor can be controlled with a pneumatic way or with an electric way. Which is better for us is the electric way, to control the electric micromotor, of course, but it can be easily controlled also with the pneumatic system. We will see a bit more about this connection with the micromotor later in a new video, but that is very related to the control and to the video that we're making today about the pedals, because the pedals need to control mostly the electric micromotor. Watch both videos and you will have a better idea of what we are saying. With the pneumatic way, can control the electric micromotor by using a converter. So it means that from the pedal to the system that we have in the instrument tray, we just send an air signal that we convert in an electrical signal. In this case, we have this kind of pedal that is the standard that we offer, and we can control the water and the air by using a vertical movement with these two levers, and in case we press both, we have water and air together. We have also a switch to control the chair movement, a button to control the water on the spittoon, and a button to control the water on the glass. On the SS1 and SS keys, we have also on the side a lever to control the chip air. The faro pedal is not a standard, is an option. We have different type of faro pedal. As I said before, we can control electrically or pneumatically. In this case, we have two options. We have a pneumatic pedal completely, so it means that we control the micromotor with a pneumatic way, and of course also all the other instruments that we have on the dental unit. Or we have a hybrid, so it means that we control with air the high-speed turbine and the other instruments that we have on the instrument tray, except the micromotor. The micromotor is controlled with wires. So it means that we control the micromotor electrically. In both systems, the pedal look the same. If it's a pneumatic or an electric one, the shape is the same. We have the possibility to control the speed, so the air, with the horizontal movement of the feet, and to control the water with this vertical movement of the feet. By moving this lever, I just control the air, and when I press, I control also the spray of the instrument. In case you move this lever with your feet without moving this one, of course, you activate the chip air. To simplify the movement of the pedal with your feet, to move it, we have different solutions. So one is to apply this kind of system over the pedal. So with your feet, you can easily move by lifting up here, or we can install in our company this ring that it goes on the bottom of the pedal as well. Some dentists, they ask me, but your dental units are pneumatic or electric? Well, the difference is stay in the pedals actually, and how you control the instrument to the dental chair. So if you control with a pneumatic pedal, the system is mostly pneumatic. If you control with a hybrid or electric pedal, can become electric, let's say, because we control the system electrically. In our case, we use the electric system only to control the micromotor, so we don't control all the other system, as I said before, because it's kind of useless for our philosophy. We don't need it, the instrument that needs just air to work and to function. Normally we install this pedal when we don't have an electric micromotor, or when the control of the speed of the micromotor in the low speed is not so important for the dentist, because it's very used to work and it doesn't need this super clean control. Because also if you install a pneumatic pedal, the system can work super good, especially if you have also a control panel, the duopad of the micromotor, that can control the speed, and you just press the pedal here and then you control the speed on the control panel. The electric pedal, or the hybrid as we have in this case, is useful when we need a super clean control of the micromotor, or in case we use a BNR micromotor, because on the other hand, if we have a TKD micromotor, we can use both systems, electric or pneumatic, on the same board. The pneumatic version on the Faro pedal is normally used because we say that we have two options, the hybrid and the pneumatic. Pneumatic one is better to use when you prefer this movement of the feet instead of this one. It's a very complicated topic. I hope I gave at least some basic information about the difference between the two pedals and how to control the micromotor. But in case you need more information, we will be happy to give you any of them. So just contact us on our website or leave a comment below. Thank you for watching and see you next time.